Has she noticed yet? I've been lying here for days, flesh rotting, the smell of feces and urine. Please help me. Don't look over me. Don't act as if I'm not here. I would get up myself if I could. 10 years now since the stroke, praying every day that this would be the day that someone would change me, that someone would wash me, that someone would turn me over so my side would stop aching. Seemed like I've been lying in this position for the past 10 years, waiting, praying, and hoping. While Nurse Mary looks over the chart, she notices a strong odor of urine and feces. The chart reads, Renee Hughley, stroke patient, paralyzed and mute. Hi, my name is Anjanae Davis, and today I'm going to talk to you about the abuse and neglect in nursing homes. Based on my research and experience, nursing home abuse includes severe instances of abuse ranging from death to malnutrition and dehydration, inadequate medical care, and many other serious injuries and conditions. Cigarette burns, broken arms, bed sores, unreported falls, and bruises, rape, and death are some of the abuses that occurs in nursing homes today across the nation. During this presentation, I will tell you how to determine signs of neglect and elder abuse in nursing homes. We will talk about signs of facility problems, physical abuse, neglect, and sexual abuse. To determine nursing home facility problems, you should look for signs of overworked staff, lack of training in rundown facilities, and not enough nurses on duty. The staff should not be so overloaded that they can't perform their daily duties for each patient. They should be confident, knowledgeable, and able to explain what they are doing and why they are doing it. The facility should not have mildew stains, peeling paint, run-down equipment, and leaking ceilings or dirty restrooms. And there should always be a nurse within a few feet of the rooms. To determine physical abuse, you should look for bruises on the face or the body. Look for excessive weight loss and fear of staff. If it were my family member, I would ask them how they were treated, if they could tell me. But in some cases, your family member may be too afraid to tell you about how they are being treated because of the retaliation. I would discreetly examine my loved one for bruises and malnutrition. To determine general neglect, you should look for bed sores and rashes. This is bed sores. This is neglect. This is prolonged restraints, where restraints have been left on a patient for hours and hours without being taken off. This is rashes on the leg from neglect. This is abuse. Patients being left in the hallways, in the wheelchair for hours, unattended, soaked in urine. Bed sores mainly come from not turning a patient every few hours. Some nurses will leave a patient in urine for hours and not change their linen until shift change. This is the kind of stuff that grieves my spirit. Most of the time, nurses are in no danger of anyone checking behind them, so they get away with it. Although the halls rank of urine, most of the nurses pretend they don't smell it. Also look for unreported medical issues. Sometimes a patient may fall and a nurse will not report it on most occasions because they are in fear of getting in trouble or getting accused of not doing their jobs. When an unreported fall happens with the elderly, they can die from it. To determine signs of sexual abuse, look for flirting and touching patients inappropriately. Look for staff taking more than the normal time to bathe the opposite sex, and in some occasions the same sex. Sometimes you will find that the staff may say inappropriate things about the patient's body parts. Believe it or not, You may see some display of inappropriate relationship between staff and patients. As you can see, there are many signs of abuse. Cigarette burns, broken arms, bed sores, unreported falls, bruises, inadequate medical care, rape, and death due to the abuse in nursing homes. It can all become a thing of the past if we become more knowledgeable and identify the signs we covered and reported nursing home abuse and neglect when we see it. The next step will be to fill out a nursing home abuse complaint form. And you should be able to find this in the nursing home. Thank you.